Hi, it's Doug Holland, LMT, with another massage tip for massage professionals. I'm in my office today, just received another phone call asking, do you really do deep tissue? I know it's on your sign out there, but do you really do that? So today's subject matter and tip for you as massage professionals is this. What is the difference between deep tissue and deep tissue therapy? Well, what most of these individuals say is they've tried multiple locations. There's a claim of deep tissue therapy. They get there and the person does nothing more than spread oil on their body, or on occasion does a little bit of squeezing. Just when they start to feel a little better, the practitioner gives up. Why is that? Well, maybe it was the school they went to. Maybe it's the philosophy that you don't have to use deep pressure. But it is interesting that they actually advertise deep tissue therapy and they don't do it. Also, some practitioners simply want to save their hands, their neck, their back, because true deep pressure requires a lot of effort on the part of the practitioner. So what would be my tip for individuals that want to discover what true deep pressure is? Well, when I was in school, I used a scale of 1 to 10 to kind of figure out how much pressure I should actually use. And we remember in our books of academia, the recommendation by the experts, the people who have been doing it for 30, 40 years, they use a scale of 5 to 7 in that 1 to 10. So 5 being the most moderate pressure of deep pressure, and then 7 being the top of that threshold. So 5 being probably the least you want to go, and 7 being the top of that threshold. And that's the case with me. I like to get people between 5 and 7. 5 would be the pressure that I would use on the entire body throughout the whole treatment, and then we're going to hit 7 on occasion. You know, maybe every minute or so we're going to get in that 7 range. If we get to 8 and the person now is so uncomfortable they want to come off the table, 10, they are coming off the table, right? But 7 is where I want them at. And the only way to know that is to actually have them relate that to you. So if they're brand new to deep pressure therapy, you might want to use the numbers and let them describe it. Don't ask them, hey, is this a 5? Let them give you the numbers. So for instance, I start in with the deep tissue on a particular patient and they go, okay, that's a 4, that's a 4. You start increasing, okay, that feels like a 5. Then give them a little bit more and they go, oh, that's a 6. Now you know you're in the right direction. And then when you hit 7s, they're going to let you know. And if you hit an 8, they're going to go 8, 8, 8. Then you just simply bring back the pressure back down to 7. You see their body start to relax, but they still feel that deep, intense pressure. Now, what does deep mean? Well, if you think of swimming in shallow water versus deep water, I think most people understand that. Deep is going deep. So if you're going to advertise it, you got to do it, right? Another thing is when I am doing deep pressure therapy on an individual, is to take apart those fascial adhesions. It's to work on those trigger points. It's to work out those neuromuscular imbalances in those muscles. If a person wants just a simple relaxation massage, there's nothing wrong with that, but that's not going to happen in my office. They can go to a spa for something like that because the therapeutic benefit ends the second they walk out of that room. What we're doing here is actually trying to correct muscular and tissue imbalances in the body itself. And so a person could be sore for days. It's not uncommon to leave this office, we warn them, 72 hours of soreness if it's the first time they've ever had a true deep tissue therapy. Now, a lot of therapists think that that's unnecessary, but we don't agree with that. In order to work them, think about going to a gym. Let's just use an example of a gym. Could you imagine you hire a personal trainer and you go to the gym and you tell them, I want to work out, but I don't want to be sore. I've never worked out a day in my life. And when I start to lift weights, you know, the second you feel any kind of tension or stress, you drop them. Well, that's not reality. To have growth, there must be tissue damage. It has to take place. You have to peel things apart. So an individual goes to work out the very first time, they're going to be sore for a few days. That's just the reality of life. Then the more they get used to the training in the gym, the more they get used to stretching and exercise, the more their muscles adapt and understand nervous-wise, the nervous tissue understands what's happening, and the soreness becomes less and less, and it becomes more tolerable in the future. But if you're going to correct issues on people, they have to feel some sense of soreness. Otherwise, you didn't go deep enough. That's just the reality. So that's my tip to you. Look at the scale of 1 to 10, 1 spreading oil, 10 being like their body's on fire. We don't want to go there. Try to find that sweet spot between 5 and 7. Have them relate those numbers to you so you know where you're at. Try to keep the majority of the massage around 5 and then hit those 7s as you're going through. And you'll see that your patients will reward you for that. Now, I lose 1 out of 10 people here because they can't handle the pressure. And it really is amazing to me how some people come through the door and say, I want deep pressure, give me everything you got. And the second you start on them, they're flying off the table. So some people don't really know what deep pressure therapy actually feels like. So those individuals, we both laugh about it. But we're going to lose them because that's not what they're looking for. They're looking more for a superficial relaxation massage. So just remember this, guys. If there's no discomfort on the table, if you're not between 5 and 7, well, then it's nothing more than a foo-foo massage.